So we are at the Ethoss booth, and I have with me Dr. Anthony and Joe, and these are the best guys. You can come and discuss about Ethoss, the scientific guy and the sales guy, I think. That's great. So what makes Ethoss different from other grafting?
So whenever you try to do a grafting, there are always problems with what product to use. So xenografts is not really a bone, it's just like sits there. Yeah, it's animal. Imagine putting a cow inside the mouth of a patient. And allograft doesn't...
it's worse, it's dead human.
It's a human, yeah. Plus the volume thing and everything. So Ethoss is completely synthetic. It solved a very big problem that it resolves over 1 year. It gives the body enough time for your own bone to regenerate. So here we're not talking about augmentation, we are talking about regeneration and true regeneration concepts. And because it's made out of beta calcium phosphate and calcium sulfate, the calcium sulfate actually sets, so you don't need any membrane with it. And this gives you a freedom to act about your flap and the suturing technique. So you can do second intention healing. And if there is
you don't have to worry about graft exposures, membrane exposures, so it will heal.
Yeah, and you don't have also to worry about perio problems. You can gain a lot of keratinocyte tissue because of that. You only suture a sponge in the open space and it will give you keratinocyte tissue. Because keratinocyte tissue and keratinocyte tissue, it is keratinocyte tissue.
Yeah, that's the most important thing.
Yeah.
And what are the challenges for the marketing and sales for? I know most of the guys are very conventional with the grafting process, and your job become really difficult with that.
So with Ethoss, it's actually quite an easy product to sell. It has so many benefits compared to a lot of products. So integrated membrane, known as collagen membrane, the speed that it works, 50% bone at 12 weeks, 100% resorbed at around a year, and the speed that not only for the dentist doing the work, but the patient. We're also thinking about the outcome for the patient. So the patient wants their own bone. They want to have their own vital bone so that they have good integration with it.
It's really natural.
Exactly, it's natural, and it's what we're not only looking for sales for us, we also want a better outcome for our patients, and
that's what everyone is striving in dentistry. We just want to give the best to the patient in total, and we don't want any fillers for sure. We need actually a living viable bone.
Yeah.
And this, Anthony, we discuss it every time. So what's better? What's better in implants? Is it the living bone, or it's just the CBCT kind of a picture, Photoshop kind of a picture, good bone, but it's dead?
Everybody asks me can you show me cases of Ethoss after 10 years? I tell them, of course I can, but after 1 year, it's meaningless because it's your own bone.
Yeah, you can't recognize.
I'm just showing you the photos that the CBCTs are for your own bone. So it gives you a nice barrier against any infection coming. So because the way it works, it is bacteriostatic. So while healing, it just fight all of the infection, and after that, it's your own bone, it's your own body responding to any infection coming there.
So basically, you just with Ethoss, you have helped the body to heal itself.
That's it.
So I think that's an amazing concept. I wish Peter was here with us to explain it a little bit more, but no worries, we have Dr. Anthony. And anything else you want to add about the grafting in the future? What's new and what's coming up in Ethoss now?
So I don't know if I'm allowed to say what's coming out.
Oh, if it's confidential, you can pass.
It is confidential, yeah.
Okay, it's okay. But we'll be having something great innovation coming up.
So actually, you are now working on a bigger particles of beta calcium phosphate. So that would help us do bigger cases,
long augmentation spans.
Yeah, that's it.
That's amazing. That's amazing. So straight from the two best guys for Ethoss, and thank you so much.